Hi, it's Dr. Robert Brueck coming to you again. What we're going to do is, and we're going to start making this part of our weekly broadcast, telecast, YouTube videos, whatever you want to call them. I'm going to try to answer questions that many patients ask me repeatedly throughout the months and years and the 37 years I've been in practice. And so we're going to ask the question, and then I'm going to give you my take on what I think the appropriate answer would be. And again, it's not a right or wrong thing. It's one man's opinion, it's my opinion, but it's based on 37 years of experience. And again, I always try to tell people, experience is something that you get from going to the operating room every day. You don't read about it, you don't put a DVD in the computer, you actually get in there and you do, and you work, and you do a time in and time out. First thing I want to talk is type of implant. Silicone versus saline. For a long time, silicone was banned and all we had was saline. Through the years, it would just hurt me to be able to say, I can't give you silicone, I can only give you saline. All things being equal, silicone is a far better product, a safer product, a softer, more natural look. So if push comes to shove, silicone is the implant of choice. The other thing I say to people, the less breast tissue you have, the more important silicone becomes, because I think, in my opinion, it gives a more natural look to a woman's breast. And the other thing that I've been doing now for the last year, maybe year and a half, is taking and placing the silicone implant either on top of or under the muscle, and then adding a patient's own fat to enhance it, usually superiorly along the top part of the breast, and then medially to give more cleavage. So there's no question that silicone is far preferable. You have a less risk or chance of developing rippling. And what rippling is nothing more than the loss of soft tissue overlying the implant, and it creates rippling like ripples on a water. So for all intents and practical purposes, silicone is the way to go. So if you're facing that dilemma and you have very little breast tissue, by all means go with silicone. Now, granted, silicone's a little more expensive, but I can tell you over the years, and again, 37 years of experience, there are many women that came in and said, I want saline, I heard silicone's bad, my next door neighbor's niece's aunt's mother's grandson, granddaughter's daughter, whatever, had saline or had silicone and her hair fell out, whatever. Silicone is safe. It's probably been the most studied substance ever put in the body. So if I had to direct my daughter or a close family relative, saline or silicone, silicone wins hands down. So all things being equal, and particularly if you have very little breast tissue, definitely go with silicone. You won't regret it. Because again, many patients come back after 3 years and say, you know what, Dr. Brueck, I should have gone with your recommendation of silicone. I'm sorry I did saline. And so somewhere down the line, it's got to be replaced. So if you have a choice and the doctor's giving you choices, choose the winner, choose silicone. I think you will be very happy you did. The only real advantage that I see in saline is that with a saline implant, you can adjust the volume. So if you have asymmetry to your breast, it's easier to correct it with saline. Silicone implants come in different sizes, like 300, 325, 350. Saline implant, let's say, is 250 cc's. You can put in 255, you can put in 260, 267, 271. So you have a variability as far as size. So in that sense, saline has some advantage over silicone. But all things being said, go with silicone. You won't regret it. The next question I want to talk about has to do with a lift. Many times women come in and they ask me, I might be the third doctor they went to, and they say, well, the doctor said I need a breast lift. When do you need a breast lift? And it's a very, very important thing. And again, it's my opinion, my 37 years of experience. The key thing in determining whether a woman needs a lift has to do with the position of the nipple relative to the inframammary fold. So if this is my breast and the nipple is above the inframammary fold, you're good. You do not need a lift. Now, what happens, many times women will go into a doctor and their breasts kind of look tired. They're sagging, they're drooping. They've lost volume as a result of pregnancy. In fact, I would say 90% of women after pregnancy will lose volume in their breasts, and the upper pole of the breast will be flat. And so we call that pseudotosis. The nipple is still above the fold, but the upper pole of the breast has been deflated. It's sort of like somebody letting the air out of the tire. And I see a lot of women that come in, and again, I might be the second, third, fourth doctor they've seen, and the doctor says, you definitely need a lift. Now, in some cases, if a woman has pseudotosis and she does not want an implant, then I will recommend a lift, because what it will do is it will make the breast look perkier and will lift it so that it doesn't look as tired. Under those circumstances, a lift may be a way to go. But at the same time, to those women, I say, have you ever thought about adding some volume to your breast with your own fatty tissue? And most women have extra fat that they don't want. They'd like to just kind of put a cream on there, like getting rid of a tattoo, put a cream on there and have the fat melt away. It would be nice. And if we can invent that, we'd be all rich. But, so sometimes what I'll do is I'll recommend a lift, particularly in people that don't want implants, and then we'll suction fat, we'll do the lift, and we'll add some volume to the breast with their own fat. And that way they can go ahead and still have a shapely breast and at the same time not have an implant. But the key thing is, where is the nipple in relationship to the inframammary fold? So if the nipple is above the fold, then you don't need to go ahead and have a lift. Sometimes a simple augmentation, or an augmentation with fat grafting along the superior upper aspect of the breast and medially along the sternum to create more cleavage. So a lot of times we do that as well. So we'll do a lift with fat grafting and no implant. And in some cases, I've even taken implants out that have been in 20, 25 years. They're rock hard. Women don't want them. They don't want a new implant put in, so we take out the implant, harvest fat, put it in there, and it certainly is a better alternative than just taking it out and putting nothing back in. So if your nipple is above the fold and you look like your breast is tired, you have what we call pseudotosis. If your nipple is falling way down off the table and well below the fold, then you definitely do need to have a lift. So it's important to understand, do I need a lift, and if so, when and how?